It has been more than 2 years since COVID made its way to Hawaii, and hundreds of people are still testing positive every day. Vaccines, boosters, and more widely available treatment options have helped to lessen COVID's impact. But what about the long-term health ramifications for survivors? Join us as we discuss the long-term effects of COVID-19. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Olena Hugh. The fight against COVID-19 continues. Some survivors are now facing an additional challenge. It has been called long COVID, long haul COVID, and post-COVID-19 condition. Now, these terms refer to the lingering effects that appear usually 3 months after the onset of COVID-19 in about 10 to 20% of COVID survivors. Symptoms may persist for months following infection, and they include fatigue, persistent cough, shortness of breath, cognitive dysfunction, and depression. What is being done to help those dealing with the long-term effects of the coronavirus? We look forward to your participation in tonight's show. You can email or call us with your questions. We also encourage you to get involved in the conversation on our Facebook page. Now on to our guests. Joining us all the way from Philadelphia is Dr. Albert Rizzo. He is the Chief Medical Officer for the American Lung Association and a board-certified physician in internal, pulmonary, critical care, and sleep medicine in Newark, Delaware. He has volunteered with the American Lung Association since 1984. Angela Keane is a former Hawaii media personality working as a reporter and anchor for over 15 years at KGMB and KHNL. After recovering from COVID-19, she has since battled long COVID. Since the start of the pandemic, she has actively lobbied for safer regulations in Hawaii with her Hawaii Kapu Breakers group. Dr. Gehan Devendra, MD, is a pulmonary and critical care physician at the Queen's Medical Center and the Director of Medical Education, Critical Care for the University of Hawaii Internal Medicine Residency Program. He sees patients who have pulmonary complications due to long COVID. And Dr. Philip Verhoef, MD, PhD, works with Kaiser Permanente Hawaii in critical care medicine. He moved to Hawaii when his wife, who is from Honolulu, accepted a position as an epidemiologist for the state. Dr. Verhoef is also serving as an assistant professor at the John A. Burns School of Medicine at the University of Hawaii. So again, we also welcome your questions. Feel free to call in or join us on Facebook. But my first question I would like to address to Dr. Rizzo is if you could perhaps explain what is long COVID and is there a definition for it?
Well, as you mentioned when you started off, it has a number of different names, which by that meaning says it's a couple different syndromes that we really don't have all the answers to, but it really is a perplexing combination of fatigue, brain fog, muscle pain, shortness of breath that occurs not only in people who have severe infection with COVID-19, but also in those who may have a mild illness. And it may show up weeks or later after the initial infection. And we started seeing all this back in 2020, shortly after the pandemic began. And then more and more individuals were being recognized, and centers across the country, many academic centers, were starting to develop clinics to specifically deal with what now has become chronic COVID or long haul syndrome. And we can talk a lot more about what the particular issues are, but it is a perplexing problem that occurs after other viral infections, but COVID-19 seems to be making it more common.
Dr. Verhoef, what would you say if someone says that they don't believe long-haul COVID or long COVID is an actual thing?
Yeah, people certainly have said that. And I think well, first off, from my standpoint as a physician, my job is to listen and to try and understand, what people are feeling and why they're feeling it. And honestly, we've seen so many cases now of long COVID that there's just too much evidence to indicate that it's a real thing. And it's funny, Dr. Rizzo mentioned that this happens after other viral infections. And I think that's true, but we've never had a single time in our sort of recent human history where so many people have gotten the same viral infection within this short period of time. And in a way, that's magnified significantly the number of people that are having these symptoms of long COVID. So, I think it's absolutely true that this is probably a disease that's been around, but now because we have so many people in such a short period of time catching COVID, we also have so many people now suffering from these long haul syndrome symptoms, and it's really a tragedy.
Dr. Devendra, what if somebody was diagnosed with COVID and then 3 weeks later after recovery presented the same symptoms upon first infection? Would that be long haul COVID, or could that be another COVID-19 infection?
It's really hard to say. Sometimes it could be another infection. Usually we don't see another infection that soon afterwards. So a lot of the times we see long COVID, and really the definition is really, there's no official consensus for the definition, but many investigators have said that around 30 days or more after having your initial infection would classify you as having long COVID. And I think the main thing to know is you really need to talk to your patients, see how they're feeling, what are their symptoms. Sometimes people can have secondary infections that come on. And so we really need to go back to the patient and say, hey, how are you feeling? What are you doing? What symptoms are you having? And bring it back to the individual.
And Angela, as a COVID-19 survivor, can you share your story with us?
Oh boy, I'll try to make it as short as possible. I contracted COVID the first week of March after conducting a wedding for a family from Australia, and the best man had COVID. He shared the mic with me, and that was enough. I confirmed later with the family. That was the first week of March. We didn't have any testing. Nobody really knew what COVID was. It was a very difficult start for me, and it lasted for 8 weeks. I didn't end up in the hospital because my doctor felt that she felt it was better for me to stay at home and that I'd be safer there and recover better. I had all of the medical necessities because of my connections and had oxygen and nebulizer and all those things. They threw a lot of medications at me at that time, multiple antibiotics, multiple steroids. Nothing put a dent in it, and it just continued to get worse for 8 weeks. By the 8th week, my doctor brought me into the clinic because I was COVID-free, and she gave me dexamethasone, which is the steroid that they now commonly use for COVID. And within 72 hours, it cleared up. But about a month later, I started getting fatigue to the point where it felt like I had jet lag every day. Muscle aches and pains, problems with ear, nose, and throat, headaches, memory loss, depression. And by the time I got help most recently, my brain was that of an 80-year-old woman in a state of pre-dementia. So, and I have scans to prove it. It's very real, and it's been quite a struggle, and I'm glad to be getting my brain back on track finally, and back to my old self.
Oh, and thank you so much for sharing your story with us and for being so open and honest. And so for one of the doctors, obviously people are trying their best to get on with their lives. Is there anything that you would say that we should do that could help, if you see someone that could perhaps be experiencing long COVID, or a family member that may be experiencing it, or what are some of the signs that we could also look for?
Well, I think as Dr. Verhoef mentioned earlier, the biggest thing we can do is listen and then be very supportive and empathetic, because this is a real syndrome that these patients are having to deal with. And the reason many clinics cropped up across the country was that multiple specialists may need to be involved to treat a patient like this. So a multidisciplinary approach with a neurologist, cardiologist, pulmonary specialist, and behavioral specialists may be needed to help to rehabilitate the patient, not only physically, but also mentally, to get through this. So I think that multidisciplinary approach is important.
Why do you think there are these long-term effects?
Well, I think there are a number of theories. Sometimes it's the severity of the initial infection that does leave scarring in the organs, the heart, the lungs, and shows up on CAT scans. But the flip side of that is many of these patients have very mild symptoms and don't show anything during that acute infection. So is this a result of the virus itself or the response by the body to the virus, leading to inflammation and damage of the organs because of the immune response? So there's still a lot of work to be done. And I know nationally, the National Institutes of Health are doing several large studies to look at the chronic symptoms.
And for the local doctors
Oh,
here.
sorry, I'm
Yes.
just going to jump in. I think that's a really important point Dr. Rizzo just made, that one of the things that we've seen with COVID is that people can get really critically ill, right? Spend a lot of the time in the ICU and on ventilators. And just that critical illness can render people pretty disabled, right? We, certainly remember taking care of patients at Kaiser, and I know they have at Queens, who, required tracheostomies and long-term physical therapy and rehab. I think it's really important to distinguish long COVID from just the consequences of critical illness. It's, as Dr. Rizzo mentioned, many people were either minimally symptomatic or just felt like they had a mild cold, or weren't maybe as sick as Angela was, but are still continuing to experience these symptoms previously. And so it's really very much a different kind of disease from just having been critically ill for a long time and having the effects of that critical illness.
And how are you able to distinguish that is from COVID also?
Cool.
So I can probably jump in there. I think really it's really hard to know. But a lot of the times what we do see is, even with mild symptoms, perhaps up to 15% of patients may have persistent shortness of breath. They may have minor abnormalities on their lung function tests. And we see that in these patients who do have long COVID. And I think it's important to follow these patients. And I think the biggest thing is we don't have enough information. And I think that is why having like Dr. Rizzo said, a combined modality in trying to figure out what's going on. You get specialists from neurology, cardiology, pulmonary that come together in COVID care clinics. We have a COVID care clinic at Queens run by Dr. Fritzi Igno and Dominic Chow. And they do fantastic work in looking at these patients over the long term. Furthermore, I think it's really important to know that we need to study long COVID. And that is why the National Institutes of Health has initiated the RECOVER trial. And I'd like to say that we're happy to be part of the RECOVER trial. Dr. Chow, Dr. Shikuma, I'm one of the co-investigators in part of the RECOVER trial. And once that trial gets started, we'll be able to enroll people and really see how we can help these patients over the long haul.
Definitely. And Angela, when did you first realize that you were experiencing long COVID symptoms, and how did you connect the dots?
It was about 30 days, actually, almost to the day after I recovered. And I noticed that with my Couple Breakers group, I would get exhausted, and my lead group members would have to take over. I would get emotional and cry for no reason. And then I started searching, and my background as a journalist, I was a health and medical news reporter. So I'm a little bit more the kind that's going to dig. And I started digging, and I found some groups, support groups on Facebook and social media. And as soon as I started reading people's comments, I'm like, wait a second, this is 100% what I have. And so to share those stories and to dig up that information, it was an eye-opener, and it was kind of scary. And there were times when I was also in denial, and I thought that I was much better. The vaccine did help me a little bit, but it was the memory problems and the exhaustion that just stuck with me. And when I went to go back to work and I thought I could do it, I lasted for about a month and I couldn't do it anymore, and I had to leave my job. So it's been a long journey, but yeah, just about exactly what the doctors are all saying. About 30 days after my diagnosis, when I started to get better, that's when the symptoms came on.
Wow. All right. We have Anthony from Facebook who asked a question. Would micro blood clots explain many of the long COVID ailments?
It's certainly one of the theories that's been proposed, that, many of you might know that when you get acute COVID or a COVID infection, your body is much more prone to forming blood clots. And we've seen lots of that as we've managed these patients. And certainly one of the theories that's been put forth is that you have both large clots, but also small clots forming throughout the body and in some of these tissues. And the damage caused by those little blood clots is perpetuating some of these symptoms. And there's some support for that. I think that's still a theory, and it's not yet certainly absolutely proven, but certainly people are investigating that as a potential explanation.
All right, we have another viewer question. Does the panel think we'll be able to safely go without masks soon? And perhaps if you wanted to add your thoughts about mask wearing as well. Maybe we'll start with Dr. Rizzo.
Sure. Well, I think mask wearing, it's all about mitigating your risk, and certainly early on the risk of society because of the abundance of the amount of people who are needing healthcare services. We were inundating our hospital systems. But I think masks do protect the individual, and they protect the people around them as well. And if you're immunocompromised, have a chronic illness, or on immunocompromising drugs, I think you err on the side of being safer by wearing masks. Now, we're certainly getting to a point where mask mandates are coming down across the country. People are starting to feel better that they've been boosted. They're up to date with their COVID vaccine and boosters, and they're starting to feel that they're more resistant to getting the infection. But it does boil down to personal risks and deciding when you want to take that risk, especially if you're living with people who are unvaccinated, small children who haven't been vaccinated. You don't want to carry that virus home. You may be asymptomatic, but you want to be careful of taking that virus back to your home.
And one thing that's clear, the risk of getting the long COVID syndrome is a lot less among vaccinated people that have so-called breakthrough infections. So even among people that have been immunized, they've gotten their 2 or 3 shots, and then they develop a COVID infection, they're still a lot less likely to develop this long haul syndrome, at least so far as we've seen, which is encouraging. And it doesn't quite get at the mask question, but it certainly gets at the same idea that there are things we can do to protect ourselves from getting the infection in the first place. And if you don't get the infection, you can't get the long-term sequelae from it.
But I think it's also important to know that even despite vaccination, you can develop long COVID. The risk is definitely less if you have been vaccinated. There's a really good study done by Antonelli that looked at, in the UK, that looked at there was a reduction in the amount of long COVID symptoms in those individuals who were vaccinated. So I think, as Dr. Rizzo and Dr. Verhoef has been saying, is how do you lessen your risk? Wearing a mask will lessen your risk. Getting vaccinated and subsequently boosted will lessen your risk. And I think doing all these in combination are really good for not only for the individual, but for all the people around us in our community.
Thank you. And Angela, what kind of process did you go through to try to treat your long COVID symptoms?
Oh my goodness. So I've been, through everything I could try. But I did do a lot of research. And as a medical reporter back in the day, I would tell my viewers that they really have to become their own expert. I'm somebody who happens to like reading medical journals. So, that's something that I was doing. I looked at all different kinds of things, keto diet, which I'm on as an anti-inflammatory thing. I did well and got help with my ENT issues and my ears. But really, the biggest thing for me was my brain. And so what I found was repetitive transcranial magnetic stimulation, which is known to, non-invasive, known to help people with memory problems, brain fog, forgetfulness, concussion. And when I went to Dr. Kiefer at Brain Health Hawaii, what he told me was, it's like I have a concussed brain, like I had a concussion. Probably, I'm guessing, from all the inflammation. I've gone through treatments now since October. I was at the highest depression and low dementia that I could ever get. And since getting treated every day with repetitive TMS, I have knocked my depression to 0. My brain activity is coming back. And he has this unique way that nobody else does. He's such a brainiac. I mean, really, he does my EEGs and brain scans weekly, and then tweaks my treatments as though it's like a prescription. And I can see the squiggle lines coming in areas where it wasn't active before. So the last part that I need to do is my frontal brain, my frontal lobe, and that's what we're working on right now. And it's really nice to be able to get up in the morning, to feel like I want to exercise, to get out of bed, to do things, and to finally just live life for the first time in 18 months. So I would say that the biggest help for me was the repetitive transcranial stimulation.
Congratulations. And to the doctors, are there any other types of treatment that you would recommend as well?
I think the important message is you want to find a doctor that listens to you and then works with you to develop an individualized plan. And I think that's important because some people, the brain fog is the key long-term symptom. Others, it's the tachycardia that they have when they stand up. Others, it's a shortness of breath and the fatigue. So each of those syndromes have its certain rehabilitation and certain devices and mechanisms that are being looked at. All of these things are being studied. So it's not one size fits all by any means.
Dr.
So
Verhoef?
true. So true.
And I think it's so important that really individualizing the treatment plan and also getting involved in studies. I think really that's one of the really important things is be a part of a study so that we can help you. We can find things that will help you in the end.
Dr. Verhoef, any other ideas or things that you're doing at the moment?
Well, I think the one thing to remember is, when you're dealing with a syndrome like long COVID, it's different for everybody, and everybody's going to need a different treatment. And I think, it's really hard. You really need to find a partner in a provider or a provider team to work with, because, what works for one person really may not work for another. It's interesting. Some of the studies of people with long COVID, they find they actually do worse when they do more exercise, for instance, right? And I think, intuitively you might say, oh gosh, I'm really fatigued. I guess I just need to push myself harder. But that may not actually be the right thing to do. And I think that really drives home the fact that this is, one, a syndrome, a disease that we don't understand very well, and two, something that really manifests differently in everybody and really needs a personalized, multidisciplinary approach to care.
Do you think maybe for those people that the body wasn't quite ready yet?
Oh, it's hard to say. And, if there's anything that this whole pandemic has demonstrated to us, it's how little we understand about the body, I can't take any COVID patient that I've taken care of and predict which ones are going to have long haul symptoms and which symptoms they're going to have. And so for us, it's been very humbling as a care provider.
And Angela, I see you nodding your head.
Yeah. I think for me, it was trial and error in the beginning. I worked with therapists, psychiatrists, my PCP, and I went through 6 different medications, psych medications, ADHD medications to sort of try to wake up my brain. But now realizing that my brain doctor, Dr. Kiefer, says, you got a concussed brain. You can't wake up those neurons. You can throw all the Adderall and all the stimulants and all the coffee you want, but it's not going to wake up your brain. So that's why I went to this treatment after failing all of those medications. And, I talked to so many long haulers that say they've been on the psych meds, they've been on the Adderall, they've tried the coffee, and they're just not getting anywhere. So really to do that trial and error, to have faith in your physicians, to look at all different avenues and be open to whatever you can to help yourself get better. And the other thing is, when you have a spurt of energy, which many of us long haulers do, we go and clean our house. We go do the dishes. We make the bed. We feel amazing because we just had one great day. And then tomorrow, flat out in the bed because we overdid it. So people really have to pace themselves.
Yeah, take it easy. All right, we have kind of a lengthy question from Mapuana from Facebook. She says, I'm at a month after infection and I'm still struggling. I was fully vaccinated and boosted and got infected around my 3-month mark. I'm still struggling physically, but she's most worried about her 3-year-old who's unvaccinated and also infected with a high fever. Are there any treatments for our toddlers? She's also been told that the toddlers have been advised to take over-the-counter medicine for children. What would you guys recommend?
I think I might be the only pediatrician on the line here.
Perfect.
But, yeah, unfortunately, there's not a whole lot that we have to offer. And, you hear about all of these, new therapies that are being developed and antibody therapies and new things, but these really haven't been approved or studied in 3-year-olds. And we're largely left with simply what we call supportive care, giving medicines to keep the fever down when they have a fever, letting them sleep, making sure that they're staying well hydrated. Kids are at less risk of developing long COVID. There's certainly some small percentage of children that do. But my heart goes out to you. It's a really tough spot to be in for you, both feeling sick yourself, but also worrying about your child. I wish I could say that we had an army of therapies that were approved for 3-year-olds, but we don't even have a vaccine for them at this point. And so this is, for parents of kids under the age of 5, this is a scary time.
Mm-hmm. And Dan from Kailua is asking, is there a specific age group that may be more prone to long COVID?
Short answer is really no. We see long COVID in many individuals. Now, we also know that if you have underlying health issues as well, you may be at an increased risk. So really, like Dr. Verhoef said, we really wish we could predict who would get long COVID and who would not.
Dr. Rizzo?
No, and I think the point is, as Dr. Devendra said earlier, these large studies like the recovery trial are going to answer exactly that. What is the certain predisposition for some individuals to develop COVID long haul syndrome as compared to others? Is it something that's genetic? Is it something based on their immune system? So we just don't know the answer yet.
All right, another question. CJ in Honolulu is asking, has the panel seen these long-term effects in other viral diseases, for example, H1N1?
As I mentioned earlier, the first time when this started to develop, it was likened to a couple other syndromes: chronic fatigue syndrome, myalgic encephalitis, post-viral fatigue syndrome. So we have had similar instances like this before with other infections. But as Dr. Verhoef mentioned earlier, the intensity and the number of individuals affected now has just brought it to a whole new level that really requires a lot more study.
And I think we may have answered this earlier, but Kosuke from Facebook says, how do you know if the symptoms are indeed long haul COVID or if it's just some other ailment or disease presenting itself?
Yeah, hard to answer that. And, we have criteria for making the diagnosis. Typically, you have to be beyond a certain period of time from your infection. Very often, people will also get a lab test to show that you've, had antibodies against, against the virus as an indication that you were previously infected. But yeah, typically it's beyond 4 weeks after your primary infection that you begin to think that this could be long haul COVID as opposed to a new infection. But that doesn't mean, I think it's still incredibly reasonable to go to your doctor and say, hey, look, I'm not feeling very well. Because we certainly have a variety of other things we can test for, other viral and bacterial infections. But, in the absence of having a slam dunk diagnostic test to say this is long COVID, often it's what we call a diagnosis of exclusion. We rule out other things and are left with the fact that we know that you had a COVID infection. We can document that with this blood work. Very likely these symptoms are consistent with it.
And Angela,
I think it's important to remember, it's important to remember that just because COVID happened, all the other diseases that cause these similar symptoms are still out there. And part of the way you go down the list of is this COVID long hauler or not, is you eliminate those other more common diseases that we've been dealing with all along.
And how would you test for some of those other diseases?
Well, certainly if you're worried about shortness of breath, fatigue, there's cardiac evaluations, pulmonary function studies. looking for anemia, lab work. So there's a lot of things we can do to look for those other conditions and then decide this may absolutely be a post-COVID syndrome.
All right. And Angela, you're talking about bouts of depression and also finding other groups of people where you identified yourself, that's me. What did you learn from discussing these things with the groups, and what kind of advice do you have for caretakers and caregivers?
Wow, it was interesting because when we started sharing stories and we found similarities, we looked at those timelines. So for me, it was the first week of March 2020, and those who had COVID around the same time all had the same similar symptoms. And I would get messages, DMs from former colleagues, friends, hey, I had COVID. I know you had COVID. What's going on? So that's really interesting. For the caregivers, I would say patience, especially with the brain issues, the depression. I know for sure in my life, I've pretty much always been a happy person. And to be that low, to be that high of depressed and ready to check myself into the mental ward, I just can't believe it. And to know that there's somebody by them that's caring for them, that patience, that aloha, that just understanding that fits happen, cry spells happen, frustration happens. You feel like you're just never going to get better, and that this is always that that monkey on your back that you're trying to get rid of so that you can get back to life. So I think really for the caregivers, it's about patience. For those that are seeking to share their information, look for people like yourself who have some of the same symptoms so that you can collaborate together, have that camaraderie, and share your ideas about what worked for you.
And for those watching at home, we also have some graphics that we can present to you on the screen if you'd like to reach out and get help as far as treatment. There are facilities here on the island where you can call or you can see a doctor. But I also wanted to ask, if you have long COVID, would you be considered contagious at all?
No, no. When you have long COVID, first of all, we don't know the exact mechanism which is causing long COVID, but we do think there are many theories. One theory is, are there microclots causing the brain fog? Other theories are there autoantibodies directed to other parts of your other cells or other areas of your body that could be causing your symptoms? So I think the real thing is, no, it's not. You're not going to be contagious per se with your long COVID symptoms.
Okay, good to know. Because I'm sure, if some people are coughing, family members might be concerned. We have another question, Pedro from Honolulu. What should be the course of action if one believes that they have long COVID?
The discussion with your physician is the first thing to do, and see if you need help from other specialists, depending on what your symptoms are. But I think that dialogue has to begin with your physician.
And how often are our local doctors seeing that or hearing that?
I'll let the local doctors answer that.
I think the main thing is, just as Dr. Rizzo, if you are having symptoms over 4 weeks after your initial infection, really need to have that conversation with your physician. Book an appointment, see that physician, and it's really the relationship that you have with your primary care doctor. And then after that, any other specialists that come on board that are specific to what your symptoms are.
So are you
I think, I'd want to emphasize, I think, as I think I read somewhere, we've had upwards of 100,000 cases just in the last month alone. And if you think about those numbers, that means we'll expect to see 15, 20,000 new cases of long COVID here in the islands over the next month. And so you won't be alone if you're feeling this way. And your doctor is very likely seen lots of other people with it. And so, everybody is basically putting in place systems and setting up clinics and basically creating the infrastructure for taking care of you, because it's going to be just as much a pandemic of people suffering from this as it is from the acute infection.
Would you say that there are any particular variants that are more prone to long COVID?
I don't think we have that information, especially now with the recent Omicron variant. We don't know if that's going to have increased long COVID symptoms or not.
Okay. What kind of advice would you have for people who were diagnosed with COVID-19? Should they be on the lookout about 3 weeks later, or just kind of go on with their lives, or just take things slow?
I think you want them to be attentive to symptoms, but I would hope that they don't dwell on the fact that they're going to get long COVID. I think it's important to recognize symptoms, and if they persist beyond what seems normal to them, again, the discussion with your doctor is really where you want to start.
Okay. And so, Angela, obviously this has been such a challenging time for you. Would you say that it had an impact on your family, and what kind of things did you do to try to, offer support for them as well?
Oh gosh, so stressful. I think probably my husband gets angel wings because he's done such an amazing job of putting up with me, putting up with my depression, my very much neediness. My family has been nothing but supportive. My community group, the Kapu Breakers group, have been incredible, taking over on days that I couldn't. I think therapy is really important, not just for the patient, but for the family members, and to share news articles, to share experiences. It wasn't until my husband saw my brain scans, my brain maps, my EEG, that he understood really how damaged, how many issues were going on with my brain. So, and now I'm hearing birds chirping and all kinds of sounds that I didn't notice before. But yeah, the therapy, the patients, talking it through and sharing information.
Wonderful. And Dr. Rizzo, being with the American Lung Association, what kind of changes have you seen since COVID-19 presented itself? And what kind of things can you do, if you're a volunteer for American Lung Association, or how can people help?
Well, certainly we increased the amount of funding we did for research around COVID-19, the acute, and now also supporting several of the NIH studies for long COVID. And we, just as we mentioned, support groups are important. And we've developed online support groups at lung.org through the Inspire platform, where people like Angela can share their stories. I mean, patients learn a lot from other patients. They listen to their doctors, but they also listen to patients very well. So I think we've realized that this is an important message to get out. It has to be good information. Not all the information is in, however. We need to study more. So supporting the research, supporting the individuals with website information and the support groups is really where we're focusing our efforts.
Dr. Devendra, you were nodding along there.
Absolutely. It's really important. One, relationship with your physician. Two, getting involved in any clinical trials that are coming online regarding long COVID. Because we part of the Recover, there's other trials that are going to be out there. Get involved, because ultimately the more information that we can get about this disease, the more we can help. And I think that's the biggest message, is we all the whole medical community really wants to help our patients get over this, because this is tragic. It's heartbreaking to see, like Angela's story, what she's been going through during this. It breaks all of our hearts as physicians, and we really need to be there for our patients, and we really need to learn more about this disease.
And Dr. Verhoef, what if someone is apprehensive about reaching out to their doctor because they don't think it's all that serious and they don't want to take time away from other patients that might be more serious?
Oh gosh, I really would say, please, we don't want to see you suffer. And while I know we're all sitting here saying, gosh, We don't know why it happens. We don't know how it happens, but it also means we're really motivated to help you to try and understand. And, with the support of groups like the American Lung Association and the clinical trials that are ongoing, you know, I think it's such an important thing for us to learn from and to try and help you. So please come and see us. I know that Hawaii doesn't have enough doctors, and I know sometimes it can be hard to get in to see somebody. But honestly, it's incumbent on us to try and help you. That's why we all got into this field, and we'll do the best we can. Your health matters so much to us.
I've also found that telehealth has been really helpful. If you want to message your doctor, emailing and also asking an advice nurse are some things that I
No, it's amazing how the pandemic has advanced telehealth the way that it has. And it's not, it's not perfect, right? Obviously, we all miss seeing patients in person, but being able to see them at all has been good. And I think it's helped people be able to access care when certainly early on in the pandemic, we were afraid or trying to avoid going out. And telehealth, advancing that was a real advantage.
All right, we have another viewer question. This is Constance from the Big Island. She says, viewer received severe reaction from the Pfizer vaccine and does not have COVID, but has the symptoms of long COVID. Are there any other people experiencing this? Have you heard of this before, perhaps?
I've read some reports where people may have a reaction to the vaccine that's concerning for being similar to long COVID. I haven't seen that personally myself. And so I'm certainly not going to discount somebody's experience. I know that we've given, sort of billions of doses of the vaccine, and it's generally well tolerated, but this is a new disease and anything is possible. So, I've certainly not cared for anybody who developed symptoms as a function of the vaccine, but I've heard of it.
And there could be a likelihood that the person got a false negative, perhaps.
Entirely possible.
Maybe. Okay. Jan from Pearl City says, viewer's husband developed pulmonary fibrosis from long COVID. There's no cure. What treatment should they do? They are already seeing a doctor.
I think one of the biggest things with pulmonary fibrosis, and which really is scarring of the lungs due to the virus itself, and without knowing more about what happened, we do see scarring of the lungs in people who have been hospitalized, who have been put on ventilator machines. They have a condition known as acute respiratory distress syndrome, or ARDS, and we see that. And at this time, part of it is time. There are some clinical trials in France and in China looking at some of our medications for interstitial lung disease in those patients. We don't have enough information now, but there are ongoing trials.
Okay, and we also have a comment from a viewer saying that the recovery study is now open at the University of Hawaii Medical School. Chris also gave a phone number and an email, covid19hi@gmail.com. And we also have another question or comment. There have been some reports that the COVID-19 passes through the blood-brain barrier and in addition may attack the vagus nerve. Is that true?
I think there's a lot of theories out there as to what's happening with not only the virus, but the response to the virus. So is it related to microclots? Is it related to the immune inflammation that's a result of that? And any nerve really can be involved. So I can't specifically say anything about that vagal nerve comment, unless the other doctors have some information.
I think there was an article that was recently published looking at a certain type of cardiac pressure, looking at that, and perhaps it's due to the vagus nerve. I don't know much more about that. Dr. Verhoef, do you know of any of those studies?
Yeah, I saw that study as well. I think one of the things that we're tempted to do is try and identify a cause and then be able to target a therapy at it. And that's what's so hard with having a syndrome like this that's so sort of various in its manifestations. And so I think it's tempting to want to say, oh, it's all in the vagus nerve. Maybe we need to use a vagal nerve stimulator or some other therapy that targets the vagus nerve, and it's going to make everything better. And I think we have to be very careful and thoughtful about how we evaluate a lot of this. This really is uncharted territory.
And I think it's also important to know that I don't want any of our patients trying to get involved with non-proven type therapies, because there are a lot of people out there who are potentially out there to scam patients. And we just need to, I think it comes back to the relationship with your physician and to try to find treatments for the specific post-COVID syndrome that you have. Because the last thing we want to do, have patients do, is try really far out type therapies that could be potentially harmful or extremely costly for that individual.
And Angela, you were diagnosed so early on during the pandemic. Have you seen an evolution of treatment and whatnot so far?
I have. And it's interesting when you talk about gadgets, because I actually have a vagus nerve stimulator, one that you can use at home, because I'm one of those people that just try to threw spaghetti at the wall and just tried to find whatever I could. And it's for me now, it's the brain treatment that I'm getting that has really resolved all the bits and pieces of all the things. Yeah, I have seen an evolution. I don't know if we're really there yet for finding the whole everything in a bag kind of thing. We're all the experts are searching for all the little pieces that can help each individual patient, because each one is unique. Each one has different stages, has different types of issues. Everything, from the heart issues to my brain issues to eyesight to organs, heart rhythm. I mean, it's so many different, multifocal, as a physician would say, so many different things that come together. So you really kind of have to get that guide, that navigator, medical expert that's going to help you and be your advocate, be an advocate for yourself, and try what you can as long as it's approved. Mine is FDA approved, so I have no problem with that. My insurance paid for it because I failed so many medications. So for me, it's not a one size fits all. And I think we're going to come into a generation of long haulers, and eventually we will figure it out, just like they figured it out for MS and fibromyalgia and chronic fatigue syndrome, CFS, and other conditions. Just keep at it. Don't give up. That's the main thing.
We also have a comment from a viewer saying, I've yet to hear the panel address the importance of diet and vitamins in healing ourselves. Dr. Rizzo, would you have any recommendations?
Well, I think in general, we all feel that there are certain keys, things to being healthy: proper sleep, proper exercise, balanced nutrition, certain vitamins we know can develop deficiencies. I think you want to be careful about not overdoing any one modality that's recommended out there. Similar to what Dr. Devendra said, you don't want to look for the magic bullet. You want to use common sense, get information from trusted sources, and do what works for you.
Thank you. And, obviously this is a new experience that we're all going through, living through this pandemic, and it's changing. And so I think maybe being patient with ourselves and being patient with each other. And so Dr. Verhoef, if you could talk a little bit about what you're seeing as far as patients coming to see you now locally and what kind of treatments you're offering.
Yeah, I want to be totally clear. Most of my patient care is in the hospital, so I'm taking care of primarily hospitalized patients, and so certainly we're seeing people admitted to the hospital with COVID. We're seeing people who have had COVID previously who are dealing with the sequelae of that on top of their other medical illnesses. And very often it's very hard for us to know how to manage those long haul symptoms other than symptomatically. But you know, as I think Dr. Rizzo mentioned, this is sort of all the other diseases that we take care of haven't gone away. And so we're taking care of hospitalized patients now, more and more of them who have a history of COVID that may be complicating the other diseases that they have, whether it's their diabetes or their emphysema or their heart failure. And so certainly trying to manage them as effectively as we can is a big part of what we're doing. And maybe I would toss it to Dr. Devendra and see what you're seeing in the clinics.
Yeah, what we're seeing in the clinics is mostly people with either chronic cough, shortness of breath, and then of course the fatigue. The fatigue is really a major component that we see with these patients. And at this point, what I'm prescribing really is as really healthy diet, but also it's not a one size fits all. Some people, as you stated before, exercise may help. Some people exercise doesn't. And so we need to find what is the balance for that individual and try to maximize until we have really good proven studies that show one modality works over next. I think at this point we need to have that relationship. We need to get involved in studies.
Thank you. And we are running out of time. And so just wanted to allow Dr. Rizzo to perhaps share a final statement.
Main thing is keep a good dialogue and discussion with your physician. Look for trusted sources. And I'm kind of partial to the American Lung Association, so lung.org would be a good place to go for information.
And Dr. Devendra?
I think it comes back to the relationship with your physician and really encourage that relationship. But also, we also have to think that COVID is not just a biologic disease. We have to also think of it as a social disease as well. And so it's really important that that social isolation, things like that really will increase your stress. And so really get involved, like Angela has gotten involved in groups, get involved in those groups because that's ultimately going to help you become whole again.
Thank you. And Angela, Keane?
Well, I would say be your own expert. Be patient with yourself. Give yourself time to recover. And try what you can. If anybody has, if anybody needs to reach out, I will always be here. PBS Hawaii has my contact information. You can get me through Kapu Breakers or through Facebook or social media. But I just want to send encouragement to those who are battling this and their family members who are beside them and being their warriors and their information getters and their helpers. Be patient and do whatever you can when you can. Don't overdo it and seek the information. Be your own expert.
Thank you. And finally, Dr. Verhoef.
Just want to emphasize, this is new. This is not like anything any of us have ever seen. We're now more than 2 years into it, and we're still learning so much. And I think what that means is understand that we may not have all the answers for you, but we are certainly involved in doing the best that we can. We care about you, and we want everyone here to be healthy. And so, we're also learning as much as you are as well, and we are certainly doing the best that we can to help the people of Hawaii.
All right. And Dr. Rizzo, you did mention the American Lung Association is a good resource on their website. What kind of things can people find there? Oh, I apologize. Dr. Rizzo is not available. But for the local doctors here, do you have a website that you would recommend as well?
I think the CDC has a lot of good resources. So look at the CDC resources. They have a lot of good resources. NIH also has a lot of good information. So those are good places. Also, another good place is some of like the American Thoracic Society does have some patient flyers geared towards long COVID, and to read some of those, having that information So those are the resources I would suggest.
All right. And Angela, when you were searching for resources online, it was just like on Facebook or?
Yeah, I started with Facebook and then just kind of went further out. But I felt that Facebook was a way to connect with people who are going through the same thing, not for getting medical information. If I want medical information, then I'm going to go CDC. I'm going to go to the Department of Health. I'm going to go to Mayo Clinic. Those are the places. And really, I just went in and looked at those medical resources and
Thank
somehow
you
was
so
lucky
much.
enough to find
Excellent.
what I needed.
Medical journalist. All right. Well, we want to thank all of our guests for joining us this evening. We really appreciate you and thank you so much for your time. Dr. Albert Rizzo, who is from the American Lung Association, thank you so much. Angela Keane, COVID survivor. Dr. Gehan Devendra, pulmonologist at the Queen's Medical Center, and Dr. Philip Verhoef from Critical Care Medicine at Kaiser Permanente. Next week on Insights, we take a look at Hawaii's coffee industry. Hawaii-grown coffee is a robust and profitable export, but growers here are facing many challenges from pests, fungus, and mainland coffee companies that threaten their livelihood. Please join us then for Insights on PBS Hawaii. I'm Olena Hugh. Aloha and ahoiho.